Well, hey, Jim, last time we talked, last time you put a video out, you were nearly SK, and I am pleased to report that the rumors of your SK are greatly exaggerated and you're still here with us. How you doing?
I'm doing the best I can. Some days good, some days not so good. Huge amount of teeth loss from some of the drugs, apparently, and it. I had one come out last night while I was asleep,
Oh,
lodged in the back of my throat, and kept drinking water, trying to get it down. I knew what it was because I hadn't eaten anything, but so that's kind of what I've been dealing with. And
oh man.
yeah, and we've gotten some of the bone marrow biopsy results over and over and over again, and some came in last night, so I've been looking at those.
Yeah.
Um,
And so you've had a bunch of recent test results and I'm sure you're under continuous care right now.
oh yeah,
Um, you're at home. I mean, you look much happier than when you're in the hospital bed. You look better.
yeah. Well, during the during the time I was in the hospital, I was in the intensive care unit,
Yeah.
and they sorry, they transferred me there from um, a med surge, medical surgery. I went to ICU, and then from ICU to a cardiac care unit. I went to ICU because I started to go downhill,
Yeah.
and it frankly wasn't looking good. Um, when I did the video, I was really in terrible shape. Didn't know if I was going to survive much longer. The odds were against me because my uh, blood tests were going downhill.
Yeah.
And since I've been out of the hospital, my blood tests have come up a bit, uh, just a hair, but I'll take any little improvement I can get. I'm still a long way from normal test results in that, for example, my white count is very, very low, and my red count is low, and hemoglobin is low, and there's a whole list of tests they do. Um, one of them is ANC, and that's also quite low. Um, but had some improvements, had some things that went up a hair, and I'm hopeful they'll continue going uphill with just even small steps.
Yeah.
Um, got some. They did. My doctor, who is really good, did a bone marrow biopsy while I was in one of those rooms, and that's unusual because it's usually done in a surgical suite with a couple of specialists in the room. And she called at 7 o'clock or 7:30 and said, "I'll be there at 8:30 to do the bone marrow biopsy." And she was. And the funny thing was, I was supposed to take morphine, and we couldn't get it out of the pharmacy. And we kept trying and trying, morphine and Ativan.
Yeah.
And the doctor said, take it an hour before I do the procedure. Well, 15 minutes before we did the procedure is when I got to be able to take the morphine IV.
And if I remember, that's the really super painful procedure.
Oh, yes, it is.
Yeah.
It's without the morphine, it's a 10.
Yeah.
And it lasts for about 20 minutes. The procedure
Oh,
is to drill a hole in that knobby part of your spine at the bottom. There's those two little
yeah.
ball-like things in. She drills into one of them, sticks in what amounts to a solder sucker, and sucks out bone marrow.
Oh,
And when that happens, it's from your
yeah,
toe to your head. Yeah. But you know, you have to have it done. And I've had it done every 6 months for a couple of years now.
yeah,
And you know, you have to have it done.
yes,
There's, you need to figure out what's going on. And so the results are a mixed bag. Uh, one of them is pointing to perhaps a new disease called, I just know how to do the letters because the name of it's hard, HLH. And it's a disease where your uh, cells, white and red, are being eaten, from what I could read. And I'm hoping that's wrong, of course,
of course.
but it might explain what's going on. So we'll have to see. I
All right.
talked to Vince. I talked to the doctor in a week, and we'll
Yeah.
have a better idea then.
Yeah, and for benefit of the people watching this video, we're recording this on the afternoon of November 20th, 2025. So
Yeah.
we'll get some more context on that in several days, we hope. I think when we were talking last, you said you've been sleeping a whole bunch, and that's good for the blood to recuperate.
It, from what I've been told by nurses, it is. And during the first few days at home, I simply could not get out of bed. It just hurt
Yeah,
too much because I had the other thing going on, which is a fracture of my spine in two places. And so every kind of movement was very painful. It's becoming less painful, and I can get out, get into the walker. That's how I got into here. And if I'm sitting still, it's not so painful. But move the wrong way or twist, it reminds me that there's a fracture there.
sure.
Eventually, it will heal to some extent.
Yeah,
I don't want to do surgery because I don't think it will work. The osteoporosis in my spine is just too severe.
yeah.
Yeah.
Yeah, for sure. And that's a tricky spot to work on. Not that I'm a doctor, I shouldn't make fun of this, but as the joke goes, I stayed at a Holiday Inn one night, but I'm not a doctor. And I've had family who've had spinal surgery, and it's difficult for sure, right? So I can
Yeah.
appreciate I can appreciate that point of view. So you you made it across the house into your radio room today. I know for you that's a huge goal. Your radio room is your happy place. I'm delighted to
Yeah.
see you there
Thanks.
today.
Yeah.
Um, I'm sure.
Nothing worked when I came in here. Like, you're not connected to the internet, keyboard, mouse. It was like,
Well,
oh, great.
I think all your stuff just misses you and it wants you to minister to it. Um, it probably knocks the crap out of you for some simple steps like that, though, I would think.
Uh, it does. I walked from the master bedroom to the front door, made that trip twice, and thought, well, I'm going to do one more time. So I did it one more time. I put on the pulse oximeter. My oxygen went to 77%.
Yeah, that's not good.
So I immediately sat down and just took it easy uh, and did my best to regain my breath. But I'm going to get a new device that I can wear on my finger to report to my cell phone my oxygen level.
Yeah,
And
yeah, and that's good. Those wireless pulse ox that'll excuse me, that'll give you the data you need for sure. Um,
it will, yeah.
yeah,
Um, so that's on my list of things to get. Been doing a few other things. So I have a computer next to the bed connected to a TV, and so I can turn that on and answer emails and
yeah.
you know chat with some friends like you.
Yeah, yeah, we've had a bunch of good chats over the past couple of weeks. It's been some rough days and some not rough days, but I know how much you look forward to those things. So, to those
Yeah, I do.
meetings.
Yeah.
So Jim's friends, keep sending him notes of well wishing and encouragement. Your last video, where you said I'm almost an SK, and I'm really glad we're doing another one because you're not. By the way, if that isn't bloody obvious, um, you had, what was it, 12,000 comments or something?
It's a huge number. I've got 40,000 um, uh, thumbs up comments, and I should say views,
Yeah.
and then several thousand comments, uh, for which I'm incredibly grateful. People
Yes.
have been really kind. Every one of those has some kind words in it, words of encouragement. And at times when I'm in really bad pain, which is sometimes often, um, if I start reading through those, I feel a lot better. So it's better than taking narcotics, which I don't like to do because they basically don't work all that well.
Yeah.
But
And they come with side effects.
they do. And we'll touch on that in just a minute. But for everyone who read and for those who comment, uh, thank you very much. You can't imagine how nice people have been. Um, uh, just absolutely wonderful, and so a big thank you for that. It's been more than I had more than I could hope for. So thank you very much, and uh, it like I said, it's better than narcotics, which I have. Um, I have like three kinds, and the side effects from those narcotics, it makes it really hard to take them
Yeah.
and get through it. So, um,
That's good. I mean, I just took a look at the video again. A little over 40,000 views. I had the number wrong on comments. Just shy of 2,000
yeah,
comments on it. And yeah, I've perused through them and they're all very lovely. So I hope you
it's
gain a whole
amazing.
lot
Yeah,
of lovely comments here too.
isn't that amazing? I mean,
Yeah.
it's just staggering how nice people have been. And then, what you don't know, I've gotten hundreds, if not 1,000, private emails, um, of just encouragement written separately because they have a story they want to convey.
Yeah.
So they've written to me directly, and that's great. I appreciate that a lot. Some doctors, some people who've lost a relative, like a parent, from what I have, and they're very supportive and wishing me the best. So, again, amazing comments, and thank you very much.
Yeah. Yeah. Good. Jim, is there anything else you want to say to your viewers?
I'm yeah. Uh, I'm going to try to be on the air a little bit. Uh, my wife would prefer I not come out here,
Uh,
but uh, it's hard for me not to, Vince. I've been on the air for over 60 years, and it's a part of me. I get up, go out to the radio room, get on the air.
yeah.
Um, During the time I was working, I would get on the air before and after. It was my enjoyment and building some things. I have some videos I would like to make, and I hope to do those. They are things that I think people will enjoy, and so producing those with the help of some friends, I think, is probably going to happen. There's you and Ben for example, V6SFX. I've been talking to him about a video. So I hope to produce some videos. I hope to get on the air. And some of this means I have to sneak out here when my wife isn't looking, which means um, walking out in a way without making noise with the walker and sort of ditching it next to a door.
That's a brand
So,
new talent, I'm sure.
yeah, it is.
Well,
Anyway, Vince, I want to thank you. You've been very kind, extremely kind in helping me do this. And for that, thank you very much. And uh, I think people who have watched the video, well, which will be two videos, I guess,
yeah,
um, will see the kindness in your heart. It just shows. So for
thank you.
that, thank you very much.
Thank you. It's my honor to help you tell your story, Jim.
Thank you.
All right. Well, Jim, pleasure to talk to you, and I hope you get some rest, and I hope your stuff in your radio room starts
Yeah,
working for you.
great. Hope so too.
All right.
73, Vince.
7-3, Jim. See you
Bye
later.
bye. Bye bye.